The first meeting of the Health Professions Subcommittee for the 2023 session is called to order. Can you call the roll?
Senator Hashmi? Here. Senator Pillion? Senator Suderline?
Yes.
Senator Donovan? Senator Lewis?
Here.
Senator Edwards?
Here.
Senator Newman?
Here.
Senator Saslaw? Senator Baker? Parker. Excuse me.
One of the it's either Barker or Baker. One of the two is here, so the other one is missing. So
you should make bumper stickers telling us this.
You have a quorum, Mr. Chairman.
Thank you very much. So, all right. Well, we first one up is Senator Boysko.
Mr. Chairman, shall we start with Senate Bill 1105, please?
Certainly.
Great. Mr. Chairman and members of the subcommittee, I've been asked to carry SB 1105, which would assign the Board of Nursing responsibility for regulating advanced practice registered nurses rather than a committee of the Joint Board of Medicine and Nursing. This was a recommendation by the 2021 Department of Health Professions study regarding the oversight and regulation of advanced practice nurses. While the regulation of advanced practice nurses varies significantly from state to state, according to the Department of Health Professions, Virginia is only one of 3 states that utilizes a joint board. In addition to being regulated by the Board of Nursing, the additional and unnecessary steps of being regulated by joint boards, the nurses feel is overly burdensome and can lead to backlogs in licensure. I've had this bill has been intended to reform the process. And before we start discussing this, I would acknowledge that I've had a lot of visits from people who are interested in this. And, I know that Andrew Lamar is here and would like to speak on it. I think perhaps we might have a solution that would be different than what you have written in the bill. So I'd like to offer him the opportunity to speak.
All right. Are there any questions or comments from the panel here at this time? All right. Andrew, so.
Thank you, Senator. Good morning, Mr. Chairman. Andrew Lamar with the Virginia Nurses Association. We've worked with all of the advanced practice groups as well. It's a good idea and a good policy going forward. There are a few questions, though, that we would like to spend a little more time working on, including if the Board of Nursing were to become responsible for regulating advanced practice nurses, perhaps the composition of the board should change. There may need to be more representation of those professions on the board. So our suggestion, and hope the committee will oblige, is to PBI send a letter to DHP, ask them to look at a couple of those issues, and perhaps we'll come back next year once that is complete. But talk with other stakeholders, and if you're amenable, we are. So.
Yes. Any comments or questions?
What does the patron say?
Yeah.
Mr. Chair, obviously I am a strong advocate for our nurses and nurse practitioners. I would like to see this move forward, but I agree that we need to make sure that we're doing it right, and I would commit to coming back next year and be the patron when we're ready to make the change for certain.
All right. Any further questions? Does anyone else want to testify to this bill? All right. If that's the case, then is there a motion in terms of recommendation to the full committee?
Mr. Chairman, I fear that if we don't do what they want,
right,
there's a lot of people going to testify. So I think we should probably do what the patron asked and have her help write the letter and send it to the group and see if we can get it in a way that works.
All right. So we have a motion to basically PBI and write a letter asking the health professions to study this during the year and get all the stakeholders involved in the process. And then move from there. So we have a motion and a second. Any further discussion? All right. Call the roll on the motion.
Senator Hashmi? Yes. Senator Suderline?
No.
Senator Lewis,
Aye.
Senator Edwards,
Aye.
Senator Newman, Senator Barker,
Aye. We have one new member.
Abstain.
Okay.
ayes 5, noes 1, 1 abstention.
All right, the motion carries. Thank you. And you have another bill here.
Yes,
so-
yes, sir. Thank you very much, Mr. Chair. Today, I present SB 1147, which would keep Virginia communities safe and healthy by addressing the needs to treat victims of human trafficking effectively in our healthcare system. SB 1147 would require practitioners regulated by the Department of Health Professions, practitioners licensed by the Board of Medicine, and practitioners licensed by the Board of Nursing to complete training on topics related to human trafficking, including strategies to identify and assist victims of human trafficking. This bill would require training standards to be approved by the Director of Department of Health Professions. A list of approved training courses should be posted on the Department of Health Professions website and shall include at least one course that is available without charge. The successful completion of this training shall be a condition of renewal of registration, certification, licensure, permit, and the issuance of a multi-state licensure privilege. Again, I have been visited by a number of stakeholders
You're popular.
and understand that the Medical Society of Virginia and the College of Emergency Physicians, with the situation that we're all in where our health professionals are really struggling, have asked that we do not mandate new training, but they do acknowledge the very importance of this issue. With that understanding, I'm open to amendments. I don't want to kill the bill. I think this is such an important issue, and I've been visited by a number of people, including some who have been trafficked. We've got to do something about this, but I am open to looking at ways that we could further increase and protect our victims of human trafficking before the committee.
Okay. Any questions or comments at this time?
Mr. Chair.
Yes, Senator Hashmi.
I've had some conversations as well with a variety of stakeholders, and there's concern about the kind of requirement for training and courses that it would place on our medical community, most of which is already considerably strained at this point with staffing issues and so forth. So I would like to offer a friendly amendment if the patron agrees, and that amendment would be that our Department of Health Professions make available this necessary information on their website and any communications, and that any of our other organizations that work, each of our health regulatory boards also then share information about human trafficking, its impact, resources, and opportunities to find change through any newsletter communications and any websites that they may have as well.
I'll second that.
All right, we have a motion and a second. Do you want to respond?
I mean, I know that there are advocates who are here today. I know that they would like to
Right.
make some comments, and I'd like to give them the opportunity. Again, Texas has passed legislation like I am offering today. This is something that, there are children who are being trafficked. There are people who have no option, and I would like to see us moving forward. There were more than 1,700 victims of human trafficking in Virginia from 2007 to 2020. And at this point in 2021, Virginia received an F, as in Frank, and failed for its response to child sex trafficking. So I would like us to listen to the testimony
We'll take all the
and then
testimony, yeah.
make your decision when you have heard them. Thank you very much.
All right. Any other questions or comments? All right. We will now go to those who are speaking in favor of the bill.
And I'll let him sit here if he like.
You forgive me if I get a little quavery in my voice. This is, in a sense, quite personal, but I won't get into that. We don't have time for it. But my name is Patrick McKenna. I'm one of the directors of the Virginia Coalition Against Human Trafficking. I've been working in the anti-human trafficking space for the last 12 years. In that time, I've worked with organizations that have identified over 300 plus survivors sitting in our local jails who didn't know that they were trafficking victims until somebody was able to bring information to them and help them to see the way they had been basically brainwashed into believing it was their voluntary choice. Today, I urge you, based on the tale of two cities, right, or you're all familiar with that tale, okay? It's going to be the tale of two trainings or not trainings. In the first case, I was a member of the coalition down in the southeastern Virginia, which encompassed law enforcement, various NGOs, non-government organizations, and a child hospital that had a child abuse center. We made a determination to try to collect statistics to answer that question. How many is this happening to in our region? You know, people are always asking for numbers. So as the entities began collecting those statistics, law enforcement and child abuse center, both in that first year, said, we are not seeing any juvenile victims. We're not seeing any. After training, second year, they saw 4. The next year, they saw 12. And in the fourth year, they saw 72. Was trafficking increasing? Or was their ability, because of their training and their increased confidence in how they were approaching survivors, enabling them to identify more survivors and therefore get them help? You understand that in that case, law enforcement then was having the ability to prosecute those traffickers because they were handing the survivors off to somebody who could build trust. And without trust, you cannot prosecute, and the survivor is not willing to come forward to stand against somebody who could seriously injure them or their families. The other scenario relates to more recently, when I was representing a survivor of human trafficking who had been abused in a federal situation, got raped. Breaking into our apartment, was raped, and was trying to get help to get a rape test done. She recognized that she was beginning to decompensate because of the past trauma in her life. She was a child abuse victim who was never recognized, even though she tried to disclose as a child that she was being victimized. And she never got help, was being trafficked by the time she was 12 years old. I'm meeting her now in her 30s after 20-something years of being trafficked and severely traumatized. She tried to check herself in voluntarily, get the test done, and get mental health training. Instead, when I finally got to her 24 hours later, she was handcuffed to a bed, and not one of those people in a system that said they were offering training, as has been suggested today by the Honorable Senator, offered training. It was available, as it was back to the hospital workers back at that child center, as it was to law enforcement, because I helped get the model policy enacted a number of years ago. It was offered to them, but they hadn't taken it until they were actually made to take the training and understood what to do. There was no help there. And so that's why I came upon a situation where not the mental health professionals in that system, not the sheriff that was involved, not the any of the staff, the PE, the medical professionals knew what to do because they hadn't actually taken the training. I believe, I'm not sure, yes, she has, a survivor advocate is here. I had to lobby all manner of people in order to be able to get this survivor advocate to go back and to be able to stand with that survivor so that she could finally, and they weren't going to do the rape test. They were not going to do the rape test because she had so compensated that they considered her combative, and therefore they weren't going to do the rape test. It took finally getting a survivor advocate to be able to go back, and only one of us could be back there at a time. It took survivor advocate the ability to be able to get her back there, to be able to relate to where she was, and to get them go forward. I'm sorry, I probably lost you somewhere along the way, but this is critical, and it's a difference between the two things. Are we going to help 72 survivors, or are we going to just leave it up to folks to take the training, and they can or they can't, based on how busy they are? Thank you so much for your time.
Thank you. All right, is there anyone else to speak in favor of the bill?
Good morning. I apologize that I'm late. There was a wreck on 95. My name is Desiree Trail, and I'm a survivor of human trafficking and presently an advisor for the Virginia Coalition Against Human Trafficking, the Central Virginia Justice Initiative, and the PD 16 Human Trafficking Task Force. I am supporting this bill for the following reasons. Folks, it is imperative that healthcare workers are mandated for specialized training for trauma-informed care concerning victims of human trafficking, as there are key differences that need to be recognized and understood by the healthcare communities while interacting and treating victims of trafficking. For example, many survivors that have been enslaved in prison and held against our will have little trust in authority figures, which will cause us to have adverse and at times combative reactions while being treated at hospitals. Survivors have been drugged to remain compliant to their traffickers, which may cause fear, resistance when given medication, or being examined, especially during a rape kit examination or any gynecological examination for that matter. Providing adequate funding for an increase of mental health providers within our hospitals, correctional facilities, and community services boards would give relief to nurses and doctors who are already overtaxed and understaffed. There have been great strides made within the anti-trafficking movement by nonprofits with improved legislation to pave the road to help survivors thrive in society and live a normal and productive life. However, we still face many obstacles once exiting the life of trafficking. Survivors are expected to assist with providing information to prosecutors and law enforcement officials to help with cases against human traffickers and drug traffickers, even at the detriment and risk to our psychological and physical well-being. And the least our elected officials can do is have the compassion to help pass legislation to assist our long-term needs of recovery, as healing often takes a lifetime and requires attention and action that has not been available in the past. Medical providers have taken a Hippocratic oath to do no harm. Legislators have taken an oath to the Constitution to ensure all of its citizens have the right to life, liberty, and the pursuit of happiness. Neither of these things can be achieved for survivors and victims alike. When it comes to us not being provided with the proper awareness, identification, and proper training to help us to achieve a life of healing and restoration as we suffer every single day of our lives, for those of us that are fortunate and blessed to have survived these horrific traumas. So I implore you to find it in your hearts to understand that if this was your child, friend, brother, sister, nephew, or niece, wouldn't you want healthcare providers across the board to have this training? And wouldn't the healthcare providers that are present here in this room, wouldn't you want your family or friends to have that same treatment when they enter your ERs, your medical facilities? And just please, folks, consider this. Thank you. Have a blessed day.
Thank you. All right, is there anyone else who wishes to speak?
Morning, Mr. Chairman. I'm Scott Johnson, General Counsel for the Medical Society. I want to thank Senator Voisko for working very closely with us. Human trafficking is a very much issue for the Medical Society. I'm glad to be able to report to you that as we talk to our medical schools, more and more of them are expanding the curriculum on this issue. EVMS, for example, is probably leading the way in others, and we support that. We support getting the word out to our members. We've worked with Senator Hashmi and the suggestion that she made as far as communication through DHP, putting this information on the website, and having the regulatory board sending out in communications and newsletters. The Medical Society is committed to communicating it out to our members directly. We checked with our friends at DHP who are here, and this is workable. So we would ask you to adopt the substituted language that Julia has and answer any questions if you have them.
All right. Any questions? Yes, Steve.
Scott, as you know, a lot of us have worked on this thing for a long time. I'm really disappointed to hear that we don't have a better grade because we passed a lot of things together. But what would it take to get the medical schools and the nursing schools to really have a strong emphasis on that? I mean, that's the part that you mentioned that kind of jumped out at me. And you know, my wife is a nurse and she's worked with me on some of my stuff in the past. Is that something that at some point, maybe as this legislation moves forward, that we could just look at and see if there's not a way to kind of encourage them to really make that part of the curriculum and part of the training?
Yes, sir, Mr. Chairman, Senator Newman, the Medical Society hosts meetings of the medical school deans on a regular basis. And not to make my good friend drive down from Northern Virginia, but I bet you would relish the opportunity to come and speak to the deans directly and tell them that this is important, and ask them as they're building their curriculum to make sure it's a priority, and you can consider that a standing invitation.
Work with, Mr. Chairman,
Yes, go
work
ahead.
with Secretary Littell on that, because that really makes a lot of sense. I mean,
Right. Mr. Chairman, Senator Newman, in some of the meetings, Secretary Littell's schedule has permitted him to attend, and so we certainly would extend to him the same standing invitation.
Right, thank you. Any other comments or questions?
Senator Hoshby's amendment, but I'd hope that you can work with the guys through this process. There's more we can do, and I think maybe Secretary Littell, we can work with them too on jump-starting some.
Mr. Chairman, I'd just like to say that over the past year, I've been working with sexual violence victims and domestic violence victims and the forensic nurses to make sure that we are actually trying to expand access to testing kits and proper treatment and therapies.
Right.
The people who have been trafficked,
Right.
they have had no choice in this matter. Sometimes children as young as 8 are put out and trafficked by their own parents. I am so passionate about this, and I know that this is a bipartisan issue, that we all care about it, and I really want us to take action, not just use it as a talking point, but actually put some shoulder behind it. And I will commit to helping lead the effort. I think it should be a bipartisan issue. I think, if Senator Newman wanted to work with me or Senator Hoshby, I'd certainly welcome that. But what I don't want to do is just for us to put some lipstick on this and then put it away and say, okay, we did something, and then leave it in a drawer. This is too important, and I just appreciate the time and the interest in this, and I think that we can turn this into something positive.
All right. Do you have language or draft? Okay, all right. All right, we have a motion and a second, and we have a draft of what we could have as a substitute, I guess, when we go to the full committee next Thursday. So unless there's any other comments, we can go have call the roll.
Senator Hoshby,
Aye.
Senator Suderline,
Is this on the amendment or on the?
The amendment.
Yeah.
Sure, yes.
Senator Donovan,
Yes.
Senator Lewis,
Yes.
Senator Edwards,
Yes.
Senator Newman,
Aye.
Senator Saslaw,
Yes.
Senator Barker.
Yes.
Ayes 7, noes 0.
Thank you. That passes. So.
Move that bill be recommended to be reported as amended.
Right. All right, we have a motion now to recommend reporting as amended for next Thursday's Education and Health Committee meeting. So if there's no further comments, call the roll.
Senator Hoshby,
Aye.
Senator Suderline,
Yes.
Senator Donovan,
Aye.
Senator Lewis,
Aye.
Senator Edwards,
Aye.
Senator Newman,
Aye.
Senator Saslaw,
Aye.
Senator Barker.
Aye.
Ayes 7, noes 0.
All right. All right, thank you very much.
Thank you.
So,
I appreciate your
certainly,
interest.
Certainly. All right, next is Senator Peake.
Good morning, Mr. Chairman, members of the committee. Are you going to
Shortcut this.
Are you going to
PBI,
just?
right?
Are you going to kill it now, or should I sit down? This is an excellent bill, Mr. Chairman, and pretty straightforward. Are you ready for me to start talking?
Go ahead.
Okay, Senate Bill
Proceed.
975. This was brought to me by some of the nurses' organizations. They're currently so it's just correcting the titling in the code section. They're all referred to as nurse practitioners right now, and we're going to break it out and call it advanced practice registered nurses, or APRNs, is what we're going to put in the code. And it spells out the 4 different types, the main types right now: nurse practitioner, certified nurse midwives, clinical nurse specialist, and certified registered nurse anesthetist. So it's really just cleaning up the code to spell that out and change it from nurse practitioner to APRNs. And I'll answer any technical questions anybody has. And we have a line amendment.
Okay.
Mr. Chair, there was one instance where striking a nurse practitioner was missed in this bill. So on line 2,943, we'll delete a nurse practitioner and insert an advanced practice registered nurse.
It was already that long. It was already that long before I got here, Mr. Chairman. I've been
All right.
instructed not to entertain Senator Suderline's
Okay.
questions, excuse me, Mr. Chairman.
All right. Any comments or questions?
I have someone here to speak if there are any questions.
All right. If there are no questions at this time, anyone want to testify in favor of this good bill?
Morning, Mr. Chairman. Andrew Lamar with the Virginia Nurses Association. Pretty technical, updating the titling of advanced practice nurses to reflect the national consensus model. Want to also thank the department and the boards for reviewing this, the Medical Society for working with us to make sure we get the language right, and would appreciate your support. Thank you.
Any questions? All right. Next.
Good morning, Mr. Chairman, members of the committee. Becky Bowers and I work with the Virginia Association of Clinical Nurse Specialists, and we prefer to be called clinical nurse specialists. And so this is a wonderful bill, and we thank Senator Peake for bringing it forward.
Wonderful bill.
Be the last time you hear that.
Look, Mayor, Medical Society,
There's the
Mr.
first
Chairman,
time.
we also agree it's a wonderful bill. We
Yes.
read it line by line, and we appreciate our nurse friends.
All
5,872, I think, or something.
That's
like
why they
that.
came to me, Mr.
That's
Chairman.
right. That's right. All right. Is there- all right. We have a motion to report and second.
Amendment, did we put the amendment on?
Vote on the amendment.
Yeah, we need to vote on the
Move the
amendment.
amendment.
Okay. All right. We have a motion and a second to fix the one place where it got left out. So, all right.
Senator Hashmi,
Aye.
Senator Suderline,
Yes.
Senator Donovan,
Aye.
Senator Lewis,
Yeah, aye.
Senator Edwards, Senator Newman, Senator Saslaw,
Aye.
Senator Barker,
Aye.
ayes 7, no 0.
Motion carries. So,
Report is amended.
all right. We have a motion and a second to report as amended. And if there's no further discussion, call the roll.
Senator Hashmi,
Aye.
Senator Suderline,
Yes.
Senator Donovan,
Aye.
Senator Lewis,
Aye.
Senator Edwards, Senator Newman, Senator Saslaw,
Aye.
Senator Barker,
Aye.
ayes 7, no 0.
All right, thank you, Mr. Chairman.
Thank you. All right. Next up is Senator Suderline.
Where would you like me to go, there or here?
Wherever you want. So,
I was thinking.
Thank you, Mr. Chairman. The bill before you is Senate Bill 948. This is policy that the Senate endorsed last year on a very strong bipartisan basis. It was such a good idea because it came from the only physician in the General Assembly. And this year I'm helping with this bill. This is regarding pharmacists and trying to expand the services that they're able to provide. We were able to get it into this place where it is now, where there is no opposition from physicians, or that I've heard from the Medical Society. The only physician looked at me differently just now.
I just am surprised, but please.
I think that's still accurate. I think that's still accurate. Yeah. You need to tell this member of your association this fine bill. It's great. So I think there will probably be some statements made by other people. I'm happy to go through that rather than present lengthy and then go through that. Also, there's an amendment that it's not, I'll let them say why they like the amendment from the society there.
Mr. Chairman, members of the committee, Scott Johnson for the Medical Society. We had outreach from DHP regarding a clarification of how the protocols come together and have provided Julia with an amendment. And basically, it has the Board of Pharmacy develop the protocols, but use a work group to put them together that has equal representation from the Board of Medicine and Board of Pharmacy. And our DH friends have reviewed the language and are fine with it. And we only have it electronically, so may I ask Julia to please read that?
Mr. Chair, the new enactment clause will say something along the lines of that the Board of Pharmacy shall adopt a protocol developed by a work group of the Board of Medicine and Board of Pharmacy and the Department of Health. And the work group shall have an equal number of members from the Board of Medicine and the Board of Pharmacy.
All right. Anyone
And so I would move that amendment be adopted.
Second.
All right, is there a second? All right, call the roll.
Senator Hashmi?
Aye.
Senator Suderline?
Yes.
Senator Donovan?
Aye.
Senator Lewis?
Aye.
Senator Edwards?
Aye.
Senator Newman?
Aye.
Senator Saslaw?
Aye.
Senator Barker?
Aye.
Ayes 7, no 0.
All right, thank you. All right, are there people who want to testify on this issue?
Good morning, Mr. Chair, members of the committee. I'm Christina Borelli with the Virginia Pharmacists Association. We'd like to thank Senator Suderline for carrying the water this year and thank Senator Donovan for her leadership on this issue. We fully believe that this will be a new access point for patients. Pharmacists already have the authority to test patients, but now in limited circumstances, they'll be able to initiate treatment, and we are excited to see this come together. So thank you so much.
All right, thank you.
Mr. Chairman, members of the sub, thank you for carrying this this year, Senator Suderline, and on behalf of Virginia Association of Chain Drug Stores, we also support the bill.
Thank you.
Mr. Chairman, members of the subcommittee, Jeff Caruso with the Virginia Catholic Conference. We have no issue whatsoever with the vast majority of the bill as it relates to the flu and strep and urinary tract infection, which I think is the bulk of the bill on lines 43 through 46. The one piece that we do have concerns about is found on lines 16 and 17, and it's where it seeks to add that language. It says, "And persons authorized to consent pursuant to subsection E of 54.1-2969. So under that code section, it says that a minor shall be deemed an adult for the purpose of consenting to, and one of those things is contraception. And in the existing statute, when lines 23 and 24, adults, those 18 and older, can get injectable or self-administered hormonal contraceptives, et cetera, directly from a pharmacy without seeing a doctor first. So by adding this language on lines 16 and 17, what we would now be saying is that not only could somebody 18 years and older go directly to the pharmacy without seeing the doctor first, but now a minor could as well. And our concern from a policy standpoint is this. So minors can already get the contraceptives without parental involvement, and we think we don't agree with that provision in policy. We think that's the wrong policy. We think this takes this even further away from parental involvement, because now not only bypassing the parent, you could also bypass a doctor. I think that makes it less safe for children and takes this policy in the wrong direction. So we would ask you to amend that section, and we like the rest of the bill.
Mr. Chairman.
Yes, Senator Donovan.
Could you please clarify where in the code it allows a pharmacist to dispense a medication without an order from a doctor? They have to have seen a doctor in order to have an established prescription. Pharmacists do not prescribe, they dispense. And there are requirements within the code requiring a authentic patient-physician relationship. Pharmacists can't give birth control to anybody without that person having seen a physician.
Thank you, Senator Donovan, Mr. Chairman. So our understanding of this code section is that while there has to be that relationship, There does not have to be a prescription for each of these things, and I think the regular doctor's involvement is what we would consider important.
Mr. Chairman, if I can follow
Senator
up.
Donovan.
I don't think you're interpreting it correctly. First of all, when you talk about the allowing to inject a medication, the only reason we have to correct that language in the code is because 4 years ago, when this bill was first introduced and carried, there was a language put in the bill because the pediatricians were concerned about pharmacists vaccinating the entire pediatric population. So that was, therefore, it said under 18 may not get an injection at a pharmacy. They had to go to the doctor. So that artificially created an obstacle. In this case, the medications that you see that are being dispensed for flu, strep, or urinary tract infection are ordered by a doctor because they are a collaborative agreement that the Board of Pharmacy and the Board of Medicine will write together that is a standing medical order for those tests only. But the language that you're referring to is just connecting the dots on what already exists in Virginia, and that is emancipated minors. If they're seeking birth control, they are already emancipated in Virginia, and that exception of the pediatric population can get their follow-up injections at the pharmacist, but they can't do it without having seen a doctor. And that's really, really important because progesterone-only injections actually prevent ovulation, and these are children that are going to school. And for them to take off of school and go to a doctor's office to get an injection that they could get on the weekend from the pharmacist is an undue obstacle and cost for them continuing a really responsible behavior. And so this is not anything threatening or new. This is just establishing in this part of the code that indeed what is already allowed elsewhere in the code is consistent. Thank you, Mr. Chairman.
All right. Thank you. Next.
Thank you, Mr. Chairman. I'm Susan Musket with Pro Family Women. And Pro Family Women is strongly opposed to this bill on the grounds of parental rights. I see this bill as a further erosion of parental rights by allowing pharmacists to begin administering birth control pills and injections of Depo-Provera to minors without any requirement for parental involvement and without the child seeing a health care provider or getting a prescription. This bill will significantly increase the sites that are available for administering contraceptives to minors behind the backs of their parents by allowing your local drugstore pharmacies throughout Virginia to begin doing so. The Virginia General Assembly should be enacting laws that protect parental rights, not enacting another example of keeping parents in the dark about what's happening to their own children. And with regards to the Senator's discussion, the protocols are already in place here in Virginia, I'll be happy to give them to you, in which adult women can go to a pharmacist and the pharmacist administers contraceptives without any prescription.
It's not true.
The protocols are there.
Well, we can have the Board of Medicine speak to that and the Board of Pharmacy. There's a bona fide patient-physician relationship, excuse me, Mr. Chairman, if I may,
Certainly.
that is required in the state of Virginia. And this bill itself, if you read line 14 through 18, says pharmacists may initiate treatment. That is not prescribed. Initiate treatment, dispense, or administer
That's the whole
follow-up.
point. They can dispense these
Correct.
without the child seeing a
You're
medical
wrong.
provider. That is Google pharmacist prescription laws.
Is
They're
the
being
Board of
passed
Medicine
all
aware?
over.
All right. This is not going to be a back and forth, but thank you for your testimony. Next.
Hi, I'm Peggy Dix with the Virginia Association of Health Plans, and we support this bill for expanding access for the two parties were able to reach.
Thank you.
Chairman Josh Hetzer on behalf of the Family Foundation.
I think she must be related.
One of our concerns is that this language would allow for pharmacists to administer COVID-19 vaccines to children without parental knowledge or consent. I'd love for someone to tell me that that's not the case, but I do believe that pharmacies do offer those. Really, I don't think you have to have a prescription or a doctor's note for that. Whatever one believes about the efficacy of these vaccines, one of the things that I've heard from countless people over the last few years is that parents are opposed to their children having these for religious reasons or a number of other reasons. So I don't know whether that was intended by this bill, but it does appear now with the new language about COVID-19 vaccines that children can get these without their parents' knowledge or consent. So we would oppose it for that reason.
Mr. Chairman.
Yes, Senator
First,
Donovan.
I'll apologize to everybody. I am tired this morning, so my filter's a little off. But we'll read in the language of the code that 18 years of older and older only, except for the one exception of emancipated minors for birth control. So nothing in here can be given to anybody 18 years or younger, and I think we're going to have pediatricians speak to this in a minute, except for emancipated minors is already defined in the law for a very, very long time when they're seeking contraceptive health care.
May I, Mr. Chairman, respond briefly? I don't know that I necessarily agree. I don't know that I agree that it has to be the code section that's referenced related to minors. I don't think it's just emancipated minors. And the 4 items that they're allowed to get without parental knowledge or consent would include the COVID-19 vaccine because it would be a communicable disease. So I would just sort of offer that to you. As we read it, we think it does include COVID-19 vaccines, and so I'd ask you to look at that carefully. Thank you.
Okay, we can do that. Yes.
Lauren Schmidt on behalf of the Virginia Academy of Pediatrics. I just wanted to clarify that the language he was referencing was passed last year. Oh, sorry. That language is not in this bill. That's already law that children can get vaccines from pharmacies, including COVID vaccine, and that's already federal guidance. So even if Virginia didn't have that law, children could already get the vaccine at pharmacies. Thank you.
Thank you.
Thanks, appreciate it.
All right, anybody else wishing to speak?
I'm Eileen Roberts with Parents for Life. Hello, Senator, again. I'm not a lawyer, so I'm not really sure what it all says. I'm with Parents for Life. I serve as a collective voice for parents throughout Virginia for the parents' right to know that their daughters are seeking medical care without parental consent or notification. So I'm not a lawyer. You're defending it, and that's, again, but do whatever it takes to protect our minor daughters. Because no matter what happens to our daughters or our sons, parents are still financially responsible for follow-up costs that may occur, such in my case for a procedure, which my husband and I were responsible for $27,000. And if I could just read one thing, consistent with the hormonal contraceptive manufacturer's instructions for use approved by the U.S. Food and Drug Administration, a pharmacist may issue a prescription to initiate treatment with, dispense, or administer the following drugs and devices to persons 18 years of age and older. So, just
All right, thank you. Yeah, yeah.
Okay, so
All right,
just
thank
protect our kids, please.
Thank you. All right, anybody else? Then we'll take a motion.
I move the bill be reported.
Second. All right.
Mr. Chairman.
Yes.
Mr. Chairman, I don't know what to think. I don't know who's right.
Yeah.
And maybe there can be some discussion between now and then, because if we're doing just what we've done before, it's okay.
Right.
She knows everything, and I know a little, but if we're expanding this to a point to where minors are not having to go through their parents as well, then that's a different policy decision, and we should know which policy decision we're making. So that reason, I'm probably going to just vote no today, and then hopefully be able to get to a point where I can vote yes in a little bit.
Next Thursday, okay. All right, thank you.
Mr. Chair, just to wrap up real quick, because like I said, I thought there would be lots of speakers.
Yeah.
So I believe that it's important that we be able to make services more readily available. That's what we keep trying to do in this committee. That's what where Senator Donovan's idea originated, to make these services. I, of course, care a lot about what parents know is happening. The decision about contraceptives, that is not a new one. That's not new to this bill. So I think that we should move forward. I'm happy to listen to all my friends and folks that aren't my friends about their thoughts about the legislation as we move along.
Okay, thank you. Anything further? All right. And do we have a motion has been proposed? Call the roll. And reporting.
Senator Hashmi? Senator Suderline?
Yes.
Senator Donovan?
Yes.
Senator Lewis?
Aye.
Senator Edwards?
Aye.
Senator Newman?
I'm going to abstain.
Senator Saslaw?
Aye.
Senator Barker?
Aye.
Ayes 7, noes 0, 1 abstention.
All right. Okay, thank you. Senator Hashmi, you're next.
Mr. Chair, can we wait to hear my bill? I'm waiting for someone to arrive.
Okay.
Thank you.
All right. Senator.
We have Senator.
Yeah, Senator Chase.
Good morning, Mr. Chair, members of the committee.
Yes.
This is a bill that you saw last year. This year it is Senate Bill 793, and this bill has to do with the treatment of COVID using ivermectin and hydroxychloroquine. And I just wanted to report back. I know Senator Donovan, we had talked about there were some stakeholders that I needed to reach out to, which I had, including Secretary Lytle, Commissioner Green, to try to reverse. There was a letter that was sent out by the Virginia Department of Health early in the game with the treatment of COVID when we were trying to figure out best courses of treatment. But there was a letter that was sent out on October the 28th, 2021, stating that VDH strongly discourages the ordering, prescribing, or dispensing of ivermectin to prevent or treat COVID-19 outside of a clinical trial. It is not approved to prevent or treat COVID-19 or any other viral infection. The VDH did not cite any evidence to make this claim. And the concern here is that letter created a chilling effect on our healthcare providers who were prescribing ivermectin and hydroxychloroquine as a part of their regimen. What we have since seen, and like I said, I've met with these stakeholders, and there's there's a group of doctors that don't support it. There are some that do, even on my own team. But what we've come to the agreement is that patients together with their doctors should have the right to choose. I mean, we are a right to try state, and we had legislation that passed a number of years ago indicating that we're a right to try state, and we should give it's House Bill 1750, Virginia Right to Try Act, that we need to give people choices. And, these ivermectin, hydroxychloroquine has been used over 40 years. It's been used around the world. And in fact, in countries like Africa, they call ivermectin Sunday because they take it on Sunday, and they noticed in those countries that there was an incredibly reduced chance and probability of getting COVID. I have a list of board-certified doctors that support ivermectin and hydroxychloroquine to treat COVID. You've got just a couple I'll mention today. I'm not going to give you a whole bunch, but I have a number of doctors. Dr. Boros is a board-certified cardiologist and a fellow of the American College of Cardiology who currently operates 3 urgent care centers in the Florida Keys. We have Dr. Paul Marek, who you all have heard before, and he is also he was a professor of medicine who served as a chair of the Division of Pulmonary and Critical Care Medicine at Eastern Virginia Medical School in Norfolk, Virginia, and as a critical care doctor at Centera Norfolk General Hospital. His research interests include sepsis and tissue oxidation. And of course, Dr. Sheila Fury, who I personally know and has been a patient of and has prescribed members of my team. And what I have seen on a personal level is I have seen patients who are dying in a hospital. And one of those is out of Virginia Beach. And if you remember, the wife came here and spoke to this committee, Jim Baker, and the wife snuck the ivermectin into him. He was on death's door. She snuck the ivermectin in and was terrified, but she did it, and she saved his life. And he is a walking miracle. And so what I would tell you, we have more evidence to support the use of ivermectin and hydroxychloroquine than we did a year ago when I presented the bill. Let's give patients, together with their doctors, an opportunity to have medical freedom in Virginia. We've got to give them that opportunity. Those are my remarks,
Okay.
and I would just
Thank you.
recommend that we would give patients medical freedom here in Virginia.
All right, anyone who wishes to testify on this bill, come forward. Yeah.
Good morning. I stand in support, again, of Senator Chase's bill. We do need to have medical freedom in Virginia, and in the United States, hydroxychloroquine and ivermectin have been shown to be majorly effective in the treatment of COVID. And I remember watching last year when many of you saw Dr. Merrick come testify and Dr. Fury come testify. Dr. Merrick's license, or his professional work has been demonized by people because he actually saved people using hydroxychloroquine and ivermectin. Once they took that ability away from him in Centera, he found that when he used their protocols in Centera to treat COVID patients, the COVID patients died. I urge you to consider giving choice back to the people and giving freedom to the doctors to do what they need to do. I don't understand why technocrats and everything can take away a doctor's right to do what they have been trained to do and to use their medical knowledge and their understanding of a patient's condition to treat their own patient. And I think that if you guys, any one of you or a family member was dying of COVID and there was that opportunity to save them from ivermectin or hydroxychloroquine, that you would want the same to be done for your loved one or for yourself. And that is what I have to say in
All
support
right.
of this bill.
Thank you. Thank you. Next.
Good morning, Mr. Chairman, members of the board. My name is Doris Kinnick. I'm also a member of the Virginia Medical Freedom Alliance, and I'm here today to encourage you to support ivermectin and hydroxychloroquine because, like Senator Chase has stated, in Africa, it has been called Sunday, and it has saved lives. The World Health Organization actually lists ivermectin as one of its essential medications. Remdesivir, yet hospitals are allowed to prescribe remdesivir. And remdesivir in Africa, during a study used for malaria, killed its subjects. And Fauci knew that. In Virginia, more than 22,000 have died from COVID as a result of being denied life-saving early treatment and being subjected to inflexible, one-size-fits-all hospital treatment protocols. Patients and doctors who honor their oath to do no harm support these medications, and agencies who've been incentivized to use drugs don't support it. If you have other bodies that come up here to argue the case here today, please ask them if they've been incentivized to push remdesivir and ventilators. Life should be supported over profit. Either vote for life and support life-saving treatments, or you'll be continuing to depopulate and decrease the numbers of Virginians. Your actions are incredibly important. Thank you for your time and attention in this
Thank you.
matter.
Next.
Good morning. I am Linda Cox. I've met you only briefly, but I'm here to support Amanda Chase's bill. Okay, so I don't know who can see this or if you want to pass it around. This is a sign that's been on my refrigerator for 8 or 10 years that I did put up there for my children. And what it says is, caution, water on road during rain. Really? So down the sides, I wrote common sense, okay? Because there are things that are common sense. So when you take ivermectin from 1996 till now, 420 deaths associated with that drug. Paxlovid, in 1 year, this year, 128. So you do the math, or I'll do it for you. In over 22 years, Paxlovid would have 2,816 versus 420. Which one is safe? Which one, it's a common sense situation to me. That's all.
Okay.
Thank you.
Thank
very
you.
much.
Thank you. All right. So the bill is before us at this time.
Mr. Chairman.
Senator Donovan.
Thank you, Mr. Chairman. I know that in this context, this seems political, and that's a real shame, because we have politicized medicine over the last 3 years and interjected opinion where there should have been research, lively, differing conversation, which really was not adequately heard on the side. And an example of that is the schools closing. And, we had clear evidence that we should never close our schools, and that debate really was overwhelmed and suppressed. This bill does one thing. It allows a doctor to use their discretion in prescribing off-label drugs. Might look political because of the drugs that are listed in there, but this is something you want. Doctors are the ones that spend their time looking at the data and deciding what can be used, what can't be used, and analyzing data long before the FDA ever decides that there might be advantages to using medications off-label. This is it's really an important statement, because when we start suppressing with regulations what doctors can and can't do, we're going to end up on a very slippery slope. So I hope you'll support this bill, and as a result, I move to recommend report.
Mr. Chair.
Yes.
Before we take a vote, may I ask Senator Donovan or Senator Chase a question? Ivermectin, as I understand it, is dewormer for bovines and for horses. I can order ivermectin off of Amazon. Is there any reason that we need to give prescriptive authority to physicians to prescribe ivermectin?
Yeah. So there's two different types of ivermectin. There's one specifically for animals, and there's one for people. And it's not readily available as it is in other countries. And the problem that we have is that because of this letter that was written by the Virginia Department of Health, by the former Commissioner Norma Oliver, it put a chilling effect. You can't get doctors to prescribe ivermectin and hydroxychloroquine, and in fact, they are concerned of losing their license, and that's still out there. What this bill does is it says, look, we have more information now, and we don't need to be debating whether ivermectin is, that's really not what the bill does. It says, let's give the doctors that choice. Let's stop penalizing them, those doctors that want to go in this direction. We now have thousands of studies, and even the only doctor who's on this panel here, and I know a lot of us are trusting Senator Donovan on that and her recommendations, and I appreciate that. But even if you're not a doctor, this is about choice. This is about not ham-hocking physicians who have been silenced and told you will be demonized if you go in this particular route. We have a whole different protocol here in America than we do other countries. My friends who are in India, it's easily accessible over the counter, and they don't understand what's going on in America. And so we need more freedom, not less. So this is about choice.
Thank you. You've answered my question. Mr.
Thank you.
Chairman, follow-up question?
Okay, I'll ask the follow-up question, and then
Last
we'll
question, I promise.
deal with the motion on the floor that's been proposed.
I'm curious too, then, Senator Donovan or Senator Chase, would a ophthalmologist then be allowed to provide prescriptions for these drugs or any drugs then because of this bill?
What this bill does is it allows, if you look at the language of the legislation, it allows any medical doctor that's
Thank you,
board
Senator.
certified. And
If
Senator
I
Donovan.
might respond, these doctors already have that prescriptive authority.
Right.
Already exists. And anybody that's an MD, including an ophthalmologist, not an optometrist, but an ophthalmologist, does have prescriptive authority to write a prescription for anything that can be prescribed.
Thank you.
And be held accountable for the consequences, which is why they take so seriously looking at all the alternatives.
Thank you.
All right, we've had a motion from Senator Donovan. We've not had a second. Does anyone want to second the motion?
Yeah, I'll second and speak to the motion.
Certainly.
Thank you, Mr. Chair. This bill, I don't think is as broad as opponents or even as one of the proponents speaking suggested. I think Senator Donovan has hit it right on the head on what's already allowed. One of the speakers in support of it was talking about how they hoped that this would change what happened at one of the hospitals. I guess it could influence what they're thinking, but they still get to decide what they want to advise their employees to do there. What this is saying is that the Commonwealth is not going to take negative action for something that they're already allowed to do. And so I don't think it's anywhere near as broad as the people that love it or the people that hate it think it is. And for that reason, I think that it's just like Senator Donovan said, and we ought to advance it.
All right. Any other comments or questions? All right. We'll vote on the motion to recommend reporting.
Senator Hashmi?
No.
Senator Suderline?
Yes.
Senator Donovan?
Yes.
Senator Lewis?
No.
Senator Edwards?
No.
Senator Newman? Senator Saslaw?
No.
Senator Barker?
No.
Ayes 2, noes 5.
Thank you.
Thank you.
Certainly.
Thank you, sir.
All right. Senator Saslaw.
Yeah. Mr. Chairman, this was brought to my attention by a former constituent. Apparently, she's diabetic, and there's a certain, needles, these little tiny needles that they can order, and she can get them from her doctor. And she went on Amazon to have them shipped to her house, and Amazon apparently couldn't ship them in Virginia. And they can only be used on these small pens, and Senator Donovan probably knows a lot more about that than I do. They can only be used on these small pens, and they're for insulin only. And they just told them they could ship them, but they can't ship them to Virginia. I mean, I don't know how that happens or how we got to that situation, but that's what the bill seeks to correct.
All right. All right. Any questions or comments?
Move to report.
Yeah, I don't want to slow it down too much. Can council explain to us possibly why we have, or where this prohibition originated?
Mr. Chair, Senator Suderline, I'm not sure that it's an explicit prohibition, but I think that the language in subsection D certainly clarifies that these needles can be shipped. I'm not sure if a prohibition exists in code that's explicit for this situation.
So we may already be allowing this, and they might just not.
She says she can get them, but she couldn't go online and get them from Amazon. But Amazon says they can ship them, but they can't ship them to her address in Virginia. That's what they told her.
And I cannot in my memory find the particular circumstances of this, but if I'm remembering correctly, they used to ship it, and then they found out there was some snag, and they said they couldn't ship them anymore, and we had to make a modification in the code to allow them to be shipped. So I can't speak to the confusion either.
Right.
Maybe Amazon could be at, the full committee. But I have had this recounted to me as well, and this is a
So
simple
you've run
fix.
into this as well.
I think it was a lobbyist, to be fair, but I'm aware of the problem. Yeah, not a patient. Yeah.
All right.
Second the motion to report.
All right. We have a motion and a second to recommend reporting.
Senator Hashmi?
Aye.
Senator Suderline?
To report, yes.
Senator Donovan,
Aye.
Senator Lewis, Senator Edwards, Senator Saslaw,
Aye.
Senator Barker.
Aye.
Ayes 7, no 0.
All right, thank you. We will recommend reporting. And that covers the docket here, so. All right.
Senator. Mr. Chair, we
Yes.
still have my bill.
Oh, you have
Yes. My support folks are here today, so
Okay.
if you don't mind.
Go ahead.
Thank you. This is SB 1005, and this is to grant our physical therapists direct access in order to provide uninterrupted treatment to their patients, and it would also increase access and effective low-cost care to our patients who are in need of physical therapy. So you may recall that back in 2021, we expanded from 30 days to 60 days the opportunity for physical therapists to treat their patients without a physician's referral. And this bill now seeks to remove to provide direct access for physical therapists to their patients in order to provide care. Again, as it was back in 2021, the goal is to take away the barriers that we often see with patients. Many times patients feel that if they have to go back to a physician to get prescription, their treatment protocol then gets disrupted for several weeks, sometimes even months, and this would help to provide a continuity of care for them. And our orthopedists have also agreed with this legislation. They're in support of it, and we have a few folks here who can provide more information.
All right. Anyone want to testify?
Morning, members of the committee. Ken Hutchison on behalf of the Virginia Physical Therapy Association. Here today in support of the legislation. I want to thank the patron for continuing the work that she began a while back. I have with me today Tom Bohannon, the legislative chair of the Physical Therapy Association, who would be happy to make just a very brief comment or two and then answer any questions you may have. Thank you.
All right, thank you. Come forward.
Good morning, Mr. Chairman and Senators. Thank you for giving me the opportunity to speak. I'm Tom Bohannon. I'm a physical therapist here in Richmond, Virginia. I own a practice, but I'm also active legislatively with the Virginia Physical Therapy Association. And this bill will increase access to providers. With the shortages of providers that we're having right now, extending the time frame allows patients to continue their physical therapy without having timely delays or untimely delays to get back into a physician when, in most cases, they only need 1 to 2, maybe 3 more weeks of treatment and they can move on. They don't need special tests or medications. Physical therapists also play a really vital role in pain management. So we help with reducing opioid stress and opioid usage in populations. This will also allow us to allow pediatric physical therapists to treat under a 504 plan, which is an accommodation plan for students. They can currently treat under direct access on an IEP, but the 504, which is a little less restrictive plan, did not have that capacity, and it was probably more of a oversight that they did not get that piece. In many cases, these individuals in the schools need physical therapy or access to physical therapy to help reduce those barriers to learning. And then it also adds trigger point dry needling to our program to be provided under direct access. Trigger point dry needling has been proven to be a very safe and effective treatment for treatment of muscular pain, and physical therapists have been performing this safely for a very long time, and we've had regulations in place since 2017 that govern this, and we're not asking to change any of the regulations, only just give us the ability to provide it under direct access.
All right. Thank you. Any questions? All right. Next.
Good morning, Lauren Schmidt on behalf of the Virginia Orthopedic Society, and I just want to say we did collaborate with the physical therapists on this legislation. We appreciate the compromises that were made and adding some language at the end to track patient outcomes. And we're fine with the dry needling as well, and think that kind of takes some of the burden off of our physicians so they can provide other services. Thank you.
All right, thank you. Next.
Good morning, Mr. Chairman, members of the subcommittee. I'm Bill Owed, representing the Acupuncturist Society of Virginia. First, I want to thank Senator Hashmi and the physical therapists through their representative, Ken Hutcherson, for their respectful and good faith dialogue to try to reach some conclusion on concerns that acupuncturists do have. To be clear, we do not oppose the general intent of Senator Hashmi's bill, only have concerns about the section dealing with dry needling, which is an invasive acupunctural procedure that physical therapists are now allowed to do with a physician's referral. Dry needling is a clearly invasive procedure. If you've never seen how it's performed, I would encourage you to do a quick search on YouTube. In addition to the insertion of needles and probing of tissue, sometimes electrodes are attached to the needles to further stimulate muscular activity. When physical therapists were first allowed several years ago to perform this procedure, additional safeguards were added requiring that it could only be done under the referral and direction of a licensed physician, which you see on line 58 of the introduced bill. This was a careful and deliberate step taken to recognize the serious nature of the procedure. Acupuncturists think it's unwise to remove this important safeguard now. However, if this referral process and safeguard is to be removed, then we feel there needs to be an adequate step taken to ensure that other acupunctural procedures are not being performed by physical therapists while dry needling is occurring. Unfortunately, it doesn't seem that right now that we can reach agreement with the physical therapist on that language that we feel would adequately ensure patient safety. I shared with Senator Hashmi yesterday, and all of you also received what we thought was the language that would best offer protection and clearly draw a distinction between dry needling and other acupunctural procedures. We hope you will seriously consider this change. If you're not agreeable with that, then we hope you would consider removing the reference to dry needling in the bill. Again, we do not oppose the general concept of this bill, but want to make sure that proper safeguards remain in place. We deeply appreciate the good faith efforts by all parties to reach consensus, and we hope we can continue that work.
I have a question.
Yes, Senator Edwards.
What's the difference between dry needling and what acupuncture do?
Well, actually, dry needling is an acupunctural procedure. So that is one of the procedures and techniques that acupuncturists use. So that is an acupunctural procedure.
So there's dry needling is an acupuncture procedure, but there's other procedures?
Yes, sir.
What are the others?
And again, I'm not an acupuncturist, so I can't tell you that the language that we have proposed to you would help draw that line between what dry needling is and what are some of the other procedures.
Mr. Chairman, what is the language? Is there some?
If you, and actually I have it if you want to see it, but it's language that we've talked to the physical therapists about. We don't agree with them on that. We're hoping we can continue to have that discussion.
Mr. Chair, if I might make a recommendation that if the subcommittee can vote to pass this bill out of subcommittee in the intervening week between now and our full committee meeting, we will work in good faith with both parties to try to reach a resolution on this issue and present it next Thursday morning.
Mr. Chairman.
Yes,
just as a follow-up, I think there's a path to do that. I've had dry needling, and I had my physical therapist say specifically, I am not licensed to do acupuncture. That is an additional licensing process that some physical therapists do. But there is a clear line here, and there is training for physical therapists to, within their scope, to do the dry needling. And so I think it's for very different purposes in different situations. Certainly wouldn't want to interfere with the acupuncturist scope either, but I think there's a path here, and that making, there were a lot of artificial re-referrals of patients back to specialists and doctors that require time away from work, a co-payment. This is a really good idea to let the physical therapist evaluate and treat, but also gives guidelines for when they need to refer back. So I would recommend we report with a expectation that there'll be some adjustments.
Second.
All right, we have a motion and a second. Any other comments or questions? All right, we will vote on the motion.
Senator Hashmi?
Aye.
Senator Suderline?
Yes.
Senator Donovan?
Aye.
Senator Lewis?
Aye.
Senator Edwards?
Aye.
Senator Saslaw. Senator Barker.
Aye.
Ayes 7, no 0.
All right. We will recommend and proceed to work your magic, so. All right, I think that takes care of it. We are now adjourned.